Surgeries for this wonderful program and opportunity. Most of the important information has already been given, and I'll just sum up from the NABH point of view. An informed consent for medical procedures and research have evolved over a period of time, right from the day of mummification. And this is a quest to help patients make better decision and take an informed decision on their life and procedure. So when informed consent is a piece of paper, it just fulfills a legal obligation. But when it is a process, it improves the quality of care. And this is the perspective of NABH from the standards point of view. And according to Joint Commission, which is another accreditation agency, informed consent is not merely a signed document. It is a process that considers patient needs and preferences, compliance with law and regulation, and patient education. So it's now an ethical standard and a legal requirement. And all these things have already been covered: implied consent, express, written, and oral consent. I'll just rush through with the NABH part alone. So consent in surgical patients, why there is renewed focus on this consent? Because this process is usual or regular for doctors and medical people, but the entire process is complicated for patients and families. And this is what the standards look at from the patients and families' point of view. And to implement this in the right perspective, we have to know the requirements of the accreditation organization. Many of the hospitals would go for JCI or NABH or NQAS or National Quality Standard or even the ISO. So each accrediting organization has their own perspective on these standards. So NABH standard is basically based on patient safety goals, which are all mandatory. And of this, consent is a mandatory objective element in the 651 objective elements in NABH standards. And this will be assessed during all levels of assessment, both during the pre-assessment, final assessment, during surveillance, and also during the re-accreditation. So the intent of this particular chapter, patient rights and education, also focus on informed consent, that it is obtained from the patient for specified procedures and care. So the organization need to have the list of specified procedures for which consent is needed. And standards also emphasize the importance of taking a general consent when the patient comes to the organization for initial care. So there is 2 standards on consent in the 4th chapter that's called patient rights to education. Informed consent is obtained from the patient or family about their care, and also the right to information and education about their healthcare needs. So basically, it's a commitment objective elements where the organization commit itself to documenting the consent process, displaying the patient rights and responsibilities, and also make their staff aware of the same. So basically, this is about having a patient care policy on consent and patient education. And this is treated as confidential. So this is very, very important process of any consent process. And the documentation is also done and treated confidential. And the patient rights also include informed consent about transfusion of blood and blood components, the various anesthesia procedures, surgery, initiation of research protocols, and any other invasive high-risk procedure and treatment. So how to go about this? And this is the 3rd standard where the entire objective element focus on making informed decision and involving the patient and family in care planning and delivery process. So it also includes notes about the expected results and also the possible complication apart from the risk, alternative, and benefits. Since most of the speakers have focused on this risk, alternative, benefits, I just skip the explaining that and go to the other objective elements. Informed consent is obtained from the patient and family about their care. So how to go about this? The most important is following the statutory requirement, particularly with reference to MTP, PCP and AT, organ transplant, and research activities, because all these have statutory implication and guidelines, and the hospital have to adhere to these norms. So this is the overview of the informed consent must do. The hospitals which are going for accreditation have to follow this do's and don'ts with reference to informed consents. The sad part is that many studies and many assessments reveal that doctors often fail to observe this practice and do not go by the spirit of informed consent. So this is more important during accreditation. And our concern is how can we improve the consent process in hospitals. As I said, informed consent is a process. So it needs right from beginning the hospital's involvement, the leadership involvement in making the right policy decision, and also training the staff and doctors about the importance, and also have an auditing system for the consent process. So how to implement an effective safe consent process is a 5-step procedure. First, the hospital has to develop policies and procedure that meet the regulatory requirement. As I said earlier, MTP has its regulation, the organ transplant has regulations, and all this have to be covered in the policies and procedure of the hospital. The next is the requirement for the policy. So the environment in which the consent is given, that is very, very important. You have to provide privacy to the patient, an introduction of the treating team, including the doctors, nurses, and other team members, and ensure that there is no interruption. This is very important. Most often it is given just before the procedure in a crowded area or just in front of the theater. So it is important that consent is given without any interruption, and there is a proper discussion and decision making. Shared decision making is important. So you have to discuss the management option with the patient and caretaker, confirm the patient choice and document it. And if patient is not able to understand, you have to use interpreter and take care of the language issues and document all these things. And finally, important is safeguard the document. And it's also important that we take the important aspect with reference to patients. Patients are in a state where they cannot take all this informed decision at this point of time. And this is where the role of the clinical leaders and nurses come into the picture. So there are 3 acceptable approaches to understanding the patient condition. That is the subjective standard. What would this patient need to know and understand to make an informed decision? How do I make this informed decision here easier process? And reasonable patient standard, what would the average patient need to know to be informed participant in the decision? And reasonable physician standard, what would the typical physician say about this procedure? So these are terminologies that has to be trained to the patient caretakers as well as to the care delivery people. The second part is policy include who's responsible for informed consent. Many of the time, the junior most people take the informed consent, take a signature in the paper, and that's it. They leave the other columns free to be filled up by the nursing staff. And it's important that we train this clinical staff, administrative staff, make them responsible for the consent process. And it's better to involve even the legal counsel of the hospital to ensure that all these people are trained in patient-provider communication. And the third important aspect is assess the patients. Most of our patients are illiterate or cannot take the various elements of informed consent. So their decision or the information, how to provide the information needs to be decided. And the decisional capacity also need to be understood by the care providers. And the voluntariness, most of them would come with one attender who may not understand that. And also we have to understand the religion, family, values, and setting. And the fourth important aspect is exceptions to the informed consent. The patient is incapacitated many of the time. There are life-threatening emergencies with inadequate time to obtain consent. And also there's a concept of voluntary waived consent. So all these things have to be noted in the case records. And of course, there's an important aspect to getting informed consent from children, blood transfusions, and also the regular dialysis nowadays. The fifth aspect is important steps in the consent. It's important that we follow these steps. So how the doctors and the medical team give the recommendation for a particular following procedure or surgery. And the next aspect is the role of the practitioner. Who is the team? Who are the doctors involved in the team? Whether it is a resident or PG going to be operated, and now the role of ghost surgeon. So all these things have to be documented in the consent process and has to be informed to the patient. The language and format of the consent is very important, that it should also go through the process of discussion, review, address all their concerns, and give time for them to take an informed decision and then obtain the signature and ensure that the medical team also signs. So there has to be a proper way of communicating and also in the language and format that they can understand. This is what the standards focus on in NABH standards, and that is a core standard in the entire assessment process. And if you are using interpreter, then their statement also have to be recorded and they have to be part of the entire consent process. And any surgery involves anesthesia, whether it's local, topical, regional, or infiltration anesthesia, and that has to be documented. So this is an overview of the informed consent from the NABH or standards perspective. Focus on all these key areas in the informed consent, the limitations, risk benefit aspects, the known risk, as well as involve the witness also to sign the consent process. And to ensure that hospitals go through this and maintain and monitor these, NABH has certain process indicators, the percentage of medical records having incomplete or improper consent, and also the percentage of consent having incomplete date, time signed by the authorized signatory. So we ensure that the hospital take care of these indicators and project during the assessment time. And so what can we do to improve the informed consent? Simplify our language. So this is a result of our assessment of over 120 hospitals, that we feel that most of the assessors feel that the language is very complicated. So it's high time we simplify the language, allow time for questions. So at least 1 or 2 days before the procedure for elective procedures, and for emergency, at least 5 to 10 minutes before the theater is ready. Make sure the patient and their family understand, plan for language assistance if there is a need, train the supportive staff to help the family, and use of interpreters. So informed consent, NABH perspective, it is the right thing to do, and it is a patient right. It is ethical. It is an important aspect of patient safety. It enhances communication. It improves doctor-patient relationship. It can and will reduce medical legal issues. And in the whole process, it will also reduce healthcare costs. So the best battle is the battle that is never fought, and best war is the war that is won without a battle. And first and best rule, common to life, asset protection, risk management, and martial arts is the same, that avoid the fight. As doctors, we have to be aware of the standard with reference to consent, communication. We have to follow compliance and also good documentation to avoid the medical legal challenges. And of course, accreditation standards will help to reduce medical legal suits and face the challenge boldly, because we have everything in documentation and also go by the standard of care. That is an important principle in all the CPA cases. Thank you so much for your kind attention, and thank you for the opportunity.